Welcome back to Healthy Habit Hacks. Today we're delving into an important topic of prehospital myocardial infarction. Now that's a mouthful, isn't it? Let's break it down. Myocardial infarction, or as it's more commonly known, a heart attack, is a serious condition that occurs when the blood supply to the heart muscle is blocked by a blood clot. Imagine a busy highway suddenly closed off. That's essentially what's happening in your heart during a heart attack. Now, if you've heard of a condition called angina, you might want to pay close attention. People with angina, an ailment characterized by chest pain that should ease with rest and medication, are at a significantly higher risk of heart attacks. Recognizing the signs and responding quickly to a heart attack emergency can literally mean the difference between life and death. So it's vital to recognize the signs and respond quickly to a heart attack emergency. Now you might wonder, what are the signs of a heart attack? Let's dive into the symptoms of a heart attack, which can often be mistaken for less serious conditions. The most common sign is chest pain, often described as a sensation of pressure, tightness or squeezing in the center of your chest. This discomfort may last for more than a few minutes, or it might come and go. And here's a crucial point. This chest pain might not stay confined to your chest. It can spread to other parts of your body, like your arms, shoulders, neck, jaw, back, or even your stomach. But the symptoms of a heart attack aren't just physical. There can be emotional signs too. You might feel an unusual level of anxiety or a sense of impending doom. Now, what sets heart attack symptoms apart is that they don't ease with rest or medication. If you've been diagnosed with angina, a condition characterized by chest pain during physical exertion or stress, you might be used to chest discomfort that goes away when you rest or take your prescribed medication, but heart attack pain is relentless. It persists regardless of rest or medication. And now, let's talk about the 4 Ps. These are key signs that can indicate someone is having a heart attack. The first P stands for pain in the chest, which we've already discussed. The second P is for pale skin. A person having a heart attack may look unusually pale or ashen. The third P is for pulse, specifically a weak and rapid pulse. And the last P stands for perspiration. Excessive sweating, even in a cool environment, can be a sign of a heart attack. In summary, the symptoms of a heart attack can be varied and complex. They may include persistent chest pain that may spread, the 4 Ps of pain, pale skin, weak and rapid pulse, and perspiration, and emotional signs like anxiety or a sense of impending doom. Remember, if you or someone else shows these symptoms, immediate emergency help should be sought by calling the emergency hotline. So what should you do if you suspect a heart attack? A heart attack is a serious medical emergency, and every second counts. Knowing how to respond can make a huge difference in the outcome. First off, it's crucial to be aware of the 4 Ps that indicate a potential heart attack: pain in the chest, pale skin, a weak and rapid pulse, and perspiration. These symptoms may vary in intensity, but they are common indicators of a heart attack. If you notice these signs, the first thing you should do is call for emergency help. In the UK, dial 999 or 112. Remember, time is of the essence, and the sooner you get professional help, the better. While waiting for the ambulance, try to position the casualty in a comfortable, semi-sitting position. This position reduces strain on the heart and helps maintain blood flow. If possible, loosen any tight clothing to aid breathing. Next, it's important to monitor the casualty's vital signs. Keep a close eye on their breathing, pulse, and responsiveness. If they are conscious, try to keep them calm and reassure them that help is on the way. Stress and panic can exacerbate the situation, so maintaining a calm environment is crucial. Now let's talk about a scenario we all hope to avoid but should be prepared for. The casualty becomes unresponsive. If this happens, you might need to perform cardiopulmonary resuscitation, or CPR. CPR involves chest compressions and rescue breaths to keep blood and oxygen circulating until medical help arrives. Remember, performing CPR can be physically demanding, and it's important to do it correctly. If you're unsure or untrained, the emergency services operator can guide you through the process over the phone. Administering aspirin can also be beneficial in a heart attack situation. Aspirin is a blood thinner and can help to prevent further clotting in the arteries. However, always consult with emergency services before administering any medication. Quick and appropriate response can make a world of difference in a heart attack situation. When it comes to a heart attack, acting swiftly and effectively can truly be a lifesaver. Now, let's delve into how a heart attack is treated in an emergency setting. When the heart muscle is starved of oxygen, immediate treatment is critical to prevent further damage. The primary aim is to restore blood flow to the heart muscle as quickly as possible. Aspirin is usually the first line of defense in treating a heart attack. It works by inhibiting the formation of blood clots, thereby helping to restore blood flow through the blocked artery. In fact, the benefit of aspirin is so significant that if you suspect you're having a heart attack, one of the first things you should do after calling emergency services is to chew and swallow an aspirin, unless you're allergic or have been advised otherwise by your doctor. However, aspirin is not the only medication used in the treatment of heart attacks. Platelet aggregation inhibitors, also known as antiplatelet drugs, play a crucial role. They prevent the blood cells or platelets from sticking together and forming a clot. This in turn helps to maintain an open pathway for blood to flow to the heart muscle. In certain cases, a medication called nitroglycerin may be administered. Nitroglycerin helps to relax and widen the blood vessels, allowing more blood to flow to the heart muscle. However, this medication is typically used in cases where the heart attack is caused by a spasm in a coronary artery rather than a blood clot. Now, in more severe cases, or when other treatments aren't sufficient, anticoagulation therapy may be necessary. Anticoagulants, sometimes referred to as blood thinners, work by reducing the blood's ability to clot. While they don't dissolve existing clots, they can prevent them from getting bigger, giving the body a chance to dissolve the clot naturally. We must remember, however, that these treatments are just one part of a comprehensive approach to managing a heart attack. Other interventions, such as lifestyle changes, cardiac rehabilitation, and ongoing medication, are crucial for recovery and prevention of future heart attacks. It's also important to note that these treatments are typically performed by healthcare professionals. If you or someone else is experiencing symptoms of a heart attack, it's crucial to call emergency services immediately. While it's beneficial to have a basic understanding of these treatments, they should not be attempted without the appropriate medical training. In conclusion, the treatment of a heart attack is a multifaceted process that involves immediate medical intervention, medication, and ongoing care. The primary goal is to restore blood flow to the heart muscle and prevent further damage. Every second counts, so it's vital to act quickly and seek medical help immediately if a heart attack is suspected. Remember, these treatments are typically administered by healthcare professionals, but understanding them can help you stay informed and calm in an emergency. We've covered a lot today, but the key takeaway is this: recognizing and responding quickly to a heart attack can save lives. It's crucial to remember that a heart attack occurs when the blood supply to the heart muscle is blocked, typically by a blood clot. This is a life-threatening situation and requires immediate attention. Those with angina are at a higher risk, experiencing chest pain that should ease with rest and medication. However, when it doesn't, it may be a sign of a heart attack. The pain may spread, and it's essential to seek emergency help immediately by dialing 999 or 112. We've emphasized the importance of recognizing the 4 Ps of a potential heart attack: pain in the chest, pale skin, a weak and rapid pulse, and perspiration. If you encounter someone experiencing these symptoms, your immediate response can make a world of difference. Remember, the first step is to position the casualty comfortably and call for emergency help. While waiting for help to arrive, monitor their breathing, pulse, and responsiveness, and be prepared to administer CPR if needed. In our discussion about the treatment of ST elevation myocardial infarction, STEMI, in an emergency setting, we've mentioned the importance of aspirin. It's a simple yet effective drug that can be administered during a heart attack. However, it's not the only treatment. Platelet aggregation inhibitors play a crucial role, as does nitroglycerin in certain cases. And in severe instances, anticoagulation therapy might be necessary. It's a lot to take in, but remember, your knowledge and quick thinking can potentially save a life. So, take the time to familiarize yourself with these signs and steps. It's worth the effort. That's all for today's video. If you found this information helpful, don't forget to subscribe to our channel for more health tips and updates. Hit the subscribe button below and turn on notifications so you never miss out on our latest content. Thanks for watching, and we'll see you in the next one.